Hey, good afternoon, everyone. All right, the buffet is looking like it was enjoyed. How about that lovely lunch from Larkspur today, ladies and gentlemen? Anytime you can get pistachio chicken, roasted salmon, and metro salad in one place, I'm there. So I'm excited to have everyone here. We're going to start out our program with an inspiring, quick little video, and then we will launch into our program. It will consist of 3 phases. One phase is, frankly, saying thank you, and we'll get into those. The next phase will be hearing from our exciting founders and the innovations that they're offering here in Kansas to strengthen and improve the health of our communities. And the third phase will be to hear from our pilot partners about their influence, collaborations, and interactions with the founders, and what that might mean for projects that'll be sprouting up around the state of Kansas. So welcome, and we'll get into the formalities in just a little bit. Let's roll tape. Okay, it has begun. Good afternoon, everyone. My name is Mary Beth Jarvis, and if I don't know you in this room, you're in this room because I want to know you, and so do the companies that are coming here to Kansas to help offer their technology solutions to make Kansas communities healthier and stronger. I'm the executive director of Nextus. We're an entrepreneurship support organization here in Wichita. We're a 501c3 nonprofit whose only mission in life is to spur the growth of small businesses, to spur the expansion of tech-enabled startups, young businesses, and the founders that help them thrive, and to push our region's pace of innovation. We believe strongly that the future of Wichita, of Kansas, of the entire middle of the country depends on it increasing its participation in the innovation economy. And with whatever resources we get and whatever energy we can muster, that's what we do every day. You are here as a part of one of Nextus's programs, but the team at Nextus executes on many. We work to make connections, run programs, and open up access to capital for young companies in our region. The Nextus staff is small but mighty. I'd love to give a shout out to Josh Oding, our president and CEO back there, yielded his cool seat to our guests today. Quinn Robertson, who single-handedly pretty much manages our Accelerate Venture Partner Angel Capital Syndicate. Quinn right there. Kate Duxler, our Director of Strategic Partnerships, and also happens to be the creator and innovator that pushes our communication face to the world. So many of you will know her for those reasons. We have another partial team member who is part us, part Network Kansas, part Midwest or Wichita Technology Corp. She wears many hats. Trish Brasted, most of you in the room know Trish. She and a guy by the name of Bob Jones, who's doing an amazing workshop for entrepreneurs tomorrow at Groover Labs, will saunter in that door super late. Blame United Airlines. But they will be here, and we're delighted to have Trish on the team as well. This event, as you saw from the video and these slides flashing through, couldn't happen without a ton of contribution and support from so many. You see name plates on the tables. Those are folks that supported today in particular. Overall program support for Nexus and the NXTSTAGE pilot competition, which we're here to celebrate today, have really enabled this work that we do to be powerful and well supported. I want to give a shout out to a couple of folks before I introduce our presenting sponsor for this particular program that has made all of it possible. But first, a couple of other shout outs. Where's the staff from the Wichita Community Foundation? Courtney, Shelley, and the crew. These guys, gosh, about a year and a half ago, they took a subpar presentation by Josh and I at their board meeting and picked up on our vision for how an innovation competition that combined the energy and innovation ambition of local businesses and community organizations with the ideas and solutions of startups from around the world, what that could do to increase the talent picture, to increase the pace and both the reality and the reputation of our region for being attractive to modern talent, innovative people, young and old, that want to make Wichita home and to help us progress into the future. And so we're excited about the Talent Ecosystem Fund and the Wichita Community Foundation that have been a part of NXTSTAGE from its very beginnings and helped power this and other programs. I'm also excited to welcome other NXTSTAGE sponsors. The Greater Wichita Partnership is here and hosted an event for us on Tuesday. We've got Network Kansas, a huge partner in a million ways and also supportive of this program. And then other folks that bought tables and that are showing up here to be a part of this occasion, from Spirit Aerosystems and Keycentrics to IMA Financial Group. Who am I missing? There's tons of folks that are a big part of this. Blue Cross Blue Shield, we'll get to them in just a second. We've got Emprise Bank, who's doing sort of a crossover support from our financial technology competition that is ongoing and will culminate later this fall. But that brings us to our presenting sponsor for this competition and today, and I'll probably embarrass Virginia here for just a minute, but I'll do so in the process of bringing her up. Almost 2 years ago, the folks from Blue Cross Blue Shield sat down and with Josh and I, before I even joined the organization, and laid out a vision for how we could reach statewide and use thought leaders and innovators in communities, rural and urban, to be sort of leaders of change and leaders of innovation. And we could bring to their door curated groups of startups with solutions that right now are making communities stronger, healthier, more connected around the world. So why not here? That was our vision. Could we bring to life innovation projects? Could we make Wichita and Kansas the air capital of the world? Could we make it the pilot capital of the world? Could we be the proving ground for great technologies, strengthening communities and businesses? Blue Cross Blue Shield and the Blue Health initiatives that are directed by Virginia Barnes jumped on board with that vision and have been part of our thought leader team, and now with the Community Health and Vibrancy pilot competition for 2021, our presenting sponsor. So we're so pleased to have the Blue Cross Blue Shield team here today, and I'm pleased to welcome Virginia to the stage.
Wonderful. Thank you so much, Mary Beth. And thank you to the whole Nexus team. You guys have been wonderful to work with. And then I just want to echo Mary Beth. Thank you to all the entrepreneurs who have participated. Thank you to our community champions who jumped on board when we made this very vague ask and said, great, we want to do this as well. And then thank you to all of you in the room for showing up and showing your support for this Community Health and Vibrancy Pilot Challenge. So as the state's largest commercial insurer, Blue Cross and Blue Shield of Kansas is really uniquely positioned to help improve the health of all Kansans. And, you know, we do this every day through excellent customer service, through providing wonderful insurance options, but that is not all we do. So we also look to how we can engage with community stakeholders and organizations who share that shared vision that we have with that value of improving those health outcomes for the state, as well as quality of life as well. And so when we have this opportunity to partner with this Next Stage competition, that's really what we're looking to do. We're thrilled that we are able to support the innovative approaches that these entrepreneurs are bringing to our state, and the community champions who have been working every day to solve the big issues that impact their local communities and maybe just didn't have the right resources or the right opportunities, the right technology to get things done. So we're so excited to be able to bring those two pieces together and see how that moves forward. And you might wonder why Blue Cross and Blue Shield, as a health insurance company, is saying, yeah, we're going to support community health through childcare or through economic development. But we do know that really health is not all about healthcare. So 60% of what affects and impacts our lives and our health and the opportunities that we have are really those social determinants of health. The education that we get, the communities and the neighborhoods that we grow up in, and the people who support us socially. So really, when we talk about the vibrancy of our Kansas communities and the health of our Kansas communities, they're entwined. Healthy communities have healthy members and vice versa. So we're so proud, again, to be a part of this, to be able to help those individual communities that have stepped up to be pilot partners engage and really bring more knowledge, not just for Kansas, but for these global and national partners that can help improve health across our state. And we're really so excited to see these partnerships grow. So again, thank you so much, Mary Beth. We appreciate it.
All right, today is all about 3 sets of who's, remember. The first who was everybody that made it possible. And for all those that I've forgotten in my remarks, you know I love you. I'm just blonde. So here comes the next set of who's, and that are the founders of the startups that have proceeded in the competition to this point. But I'm going to talk a little bit about the role that I need you to play. So everybody grab your phone. I know that's counterintuitive. A speaker never wants you to have your phone. This is overt permission to be on your phone. Now don't scroll through Twitter. Here's why I want you to have your phone. This room is full of connectors. This room is full of forward-thinking business and community leaders. I want you, with your brains engaged, for the next 11 times 3 minutes, where you hear from these innovative startups, to be thinking about who they should connect with. Who in Kansas, who in Wichita, who in your backyard, who in your circle, could they pair with to help bring the power of their innovations to Kansas communities. The next meeting they have, the next time they get to talk about their technology, the person you can forward that 3-minute video to could make a difference in the lives of Kansans and in the communities that we are trying to make healthier and more vibrant. So take that role seriously. You're going to earn that chicken and salmon and Metro salad. So we have the presentations from, so let me tell you a little bit about the competition to date. We started this spring, and we put the word out around the world. And we had 126 applicants from dozens of states, 10 countries, and we whittled it down. And through the input of our pilot partners, our NXTSTAGE staff, we found the most relevant, the most promising, the most interesting young companies offering solutions relevant to Kansas companies, or to Kansas communities. We narrowed it down to about 40, then we got it down to about 18, then we got it down to 12 finalists, and 11 of those are here with us this week. We had one finalist who you may hear mentioned by some of our pilot partners because they're still in the game to try to deploy their technology, but in the world of running a startup, they had to be 3 places in once this week and just couldn't quite pull it off. So the folks from CoTeacher aren't here with us today. But here are the folks that are, and we're going to go through them one by one. Again, videos are short. Keep your thinking head on. Keep your note-taking phone out if you need it, or if you're old-fashioned like me, get a pen. And first, let's hear from Advocacia.
Hi, I'm Laura Robbins, the co-founder and COO of Advocacia. At Advocacia, we've simplified the process of connecting your community members to the programs that they're eligible for. The genesis of Advocacia came as we assisted a woman, Avila, with enrollment into Medicaid. Through this process, we learned that Avila had utilized the emergency room for things like strep and flu. However, when she was experiencing stomach pain, she didn't know where to turn. By the time she arrived at the emergency room, she passed away within a few short days. At that moment, we realized that we had to create change. We had to create a way to not only let the individual know which programs they're eligible for and help them with enrollment, but also to empower community partners with enrollment into programs such as SNAP, WIC, and Medicaid. You may wonder, why aren't more people enrolled today? There's things like increased program complexity and eligibility requirements. Someone may have applied for SNAP last month and been denied because they made too much money. However, they may be expecting a child this month and be eligible for needed programs to support their nutrition and food. However, they may be unaware. There are also the program complexities that change yearly and sometimes monthly at a local level. There's outdated and siloed technology, making it more difficult for an individual to enroll into multiple programs. Additionally, there's the difficulty in connecting with people, especially during COVID. Pre-COVID, there were barriers such as lack of transportation, getting to local office and during office hours, and now today it's even more difficult. The enrollment options that exist are things like paper and pen, phone call, and mail. With Advocacia, we still leverage those enrollment options, but we also integrate with your solutions. We integrate with hospitals' EMR systems as well as payer platforms. We also empower those in your community to be engaged in the process through our self-service tool. We leverage things like text messaging and email to allow an individual to submit documents and signature virtually, while also allowing them to understand which programs they're eligible for. All of our solutions work together to both conveniently connect with your community as well as to empower those in the community that are assisting individuals, creating an impact across the country. For payers, we reduce the cost per member per month, and for hospitals, we're able to increase reimbursement for services rendered. These also lead to optimal results for those community partners. They're able to assist more people in the process in a shorter amount of time, helping them with several applications, allowing us to engage, empower, and to connect into those needed resources at a local, national level. We are connected to over 200 hospitals across the country, helping them in all 50 states with enrollment into things like Medicaid, SNAP, WIC, and LIHEAP, but also drilling down to a local level for programs that are a priority to our communities. Our community partners have loved using our platform to assist those, especially during COVID, and those that have engaged at both a patient, member, and community level have enjoyed using our tools and have a 4.8 star rating. Again, my name is Laura Robbins. I'm the co-founder and COO of Advocacia. I look forward to working with you.
Okay, Laura's my first victim. Laura in the corner, stand on up. Laura Robbins and her co-founder and brother Ryan Brebner are the brain power behind Advocacia. Go find her at the end of lunch. If you think you might need to connect her with someone so that more deserving Kansans can get the help they need from the programs they're entitled to improve their health outcomes, short and long term. Thanks, Laura. All right, now we're going to shift into the education technology space and hear from CoTeacher.
Will I have enough teachers to start and finish the school year? That's a question many administrators are asking themselves right now. The last 18 months have been incredibly taxing. In addition to keeping their students and themselves safe from COVID, teachers still have to do the work of teaching, and that takes a lot of time. And for many, it's just too much. We see many teachers are choosing not to come back to the classroom. If we're going to hold on to our teachers, we have to make teaching manageable. That's why we created CoTeacher. CoTeacher is a platform that breaks down silos between teachers so teachers who are working on similar tasks can find each other, work together, and save time. Let me show you how it works. So let's say I'm an AP math teacher and I want to find another Kansas teacher who's working on probability. So I go to CoTeacher and I input a specific Kansas educational standard, and look what I find. Here's a collection from another Kansas high school math teacher. Oh, and this person's profile looks interesting. I can connect with them and we can be co-teachers and work together in a range of ways that I'll show you a little bit later. So why does this matter? Teachers spend about 3.5 hours per day outside of class time planning and preparing instruction. this is how we're going to help teachers. We're going to reduce that planning time. We know that every day teachers are reinventing the wheel, duplicating the work of teachers in their district or in their region as they're planning instruction. So CoTeacher is going to break down silos between teachers. So teachers who are working on similar tasks can find each other, work together, and save time. CoTeacher is going to make teaching more manageable so your teachers stick around. Now you may be thinking, don't we already have a collaboration tool? Well, do you? So I'm a former teacher leading a team of teachers, and we've tried every other collaboration tool out there, and there's no other tool that helps teachers find and collaborate with similar teachers the way CoTeacher does. Let's talk about some of your options. You may use an LMS, and LMSs are great for top-down management of teachers and students. CoTeacher was designed for horizontal collaboration between teachers, makes collaboration much easier. And you may also use Google Drive. Now, we love Google Drive, and we know it gets a little hard to find your things when your Google Drive becomes really full. So here's a collection in Google Drive. Now, here's a collection in CoTeacher. You can take content from across the web and your Google Drive and form them into collections. You can tag resources with specific Kansas education standards, and you can invite other teachers to collaborate. Also on CoTeacher, your teachers can build public or private communities. It's an entirely new way for teachers to collaborate and to find each other and work together. CoTeacher does some amazing things, but when it comes down to it, it's about the teachers. And here's what we want to do here in Kansas. Any Kansas teacher can come on board and use CoTeacher and connect with a CoTeacher for free. That's right, any Kansas teacher can use CoTeacher for free. Now, for districts that want to have more control over their CoTeacher experience, we also offer a premium version of CoTeacher for a small fee. So whether you want your teachers to go ahead and start using the free version, or you want to use the premium version and have a more managed CoTeacher experience, we want to hear from you. I'm Daniel Fountainberry, a former middle school teacher and the CEO of CoTeacher, and I am delighted to be here in Kansas and look forward to meeting you. Thank you very much.
All right, stand on up, Daniel. Daniel Fountainberry, ladies and gentlemen, all the way in from Montreal, Canada. As you can tell from the video, Daniel's looking for lots of things. If you have connections to high school or to school principals, to Education Service Center folks, to policymakers in education across Kansas, he also wouldn't mind housing a U.S. headquarters here in good old Kansas, USA. So let's see if we can help him with all of those things. Welcome to Kansas, Daniel. All right, now we're going to hear from the folks at Dedall. Stephanie Hoskins and her co-founder and husband, Houston Hoskins. Let's roll it.
Hi, I'm Stephanie Hoskins, co-founder and CEO of Dedall. Dedall is a cloud-based software that enables organizations to discount and negotiate individual bills directly with their customers. When I worked for a large nonprofit healthcare system, I spent some time with our frontline staff and revenue cycle, and I realized a large percentage of the phone calls coming in were from patients who were desperately trying to negotiate their overdue medical bills. And we looked for solutions and tools that would enable our staff to efficiently handle these level of negotiations and phone calls, but nothing existed. And so that's what drove me to develop Dedall. So what does the average patient with medical debt look like? Well, medical debt is a barrier to care, with patients who owe their providers being 2.5 times less likely to seek care from them. Patients with debt are most likely to have insurance. They owe less than $500. They want to negotiate their debt, and this trend is increasing, with the patient portion of the bill increasing by 50% over the past decade due to the rising cost-sharing costs like deductibles and co-payments. The impact to the economy and the community is significant. Economic stability has been identified as one of the 5 social determinants of health. Every year, 70 million Americans have trouble paying their medical bills. This often results in bankruptcy, with medical debt being the #1 cause of personal bankruptcy, and crowdfunding campaigns, where 1/3 of all crowdfunding campaigns go towards medical bills. We knew that if we wanted to try to solve this problem, we would need to streamline the process and make this as efficient as possible for healthcare organizations to deploy. So we automate, simplify, and improve the process so that our clients can effectively handle thousands of patients annually. Dental works in 3 easy steps. Organizations choose which accounts they'd like to invite. Then they offer discount programs or negotiations, and they reach a new agreement on the amount owed. And then once payment has been completed, that account is resolved, and the patient avoids collections. The results to our client organizations are an improved patient experience, an increase in revenue while decreasing their overhead and expenses, and also improved access to care for patients. So the pilot program right now offers many advantages. It's very risk-free, so we have no minimum levels, there's no contract required. It's cloud-based, so you don't have to install it anywhere. And right now, early users of Dental have access to introductory pricing, special offers, and also your feedback will drive our development going forward and will be given priority when we roll out new features. We're currently piloting version 2.0 after a successful pilot of version 1 that led to several feature improvements and new features as well. And we continue to develop the product and plan to improve those metrics even further. Thank you so much.
All right, Stephanie and Houston, stand up over there. If you know a health organization that has good Kansans that owe them money, do you really want to poison that relationship by throwing it into the collection system, or do you want to work with your community members to help them get back in good stead? Because frankly, until they are, they will avoid getting the care that they need, and you will have a fractured system out in your community. So go see Houston and Stephanie after this. Thanks, guys. All right. Next, we're going to hear from Jessica Eggert and Legup. Oh, no, we're not. We are going to hear from Wesley Ma and Healthhopx, because I can't read. Sorry, Wes. Here you go.
Hi, my name is Wesley Ma, and I'm the CEO of Healthhopx. We are a social determinants of health software startup that partners community-based organizations such as your faith-based nonprofits, ethnic nonprofits, and community groups with hospitals, clinics, health insurers, and government to engage and improve the health of at-risk patients. Today, I'll be highlighting one of the cycles that millions in America go through. Here's Jack. Jack is feeling sick but doesn't want to pay money to go to a doctor. He's unsure of what the best option is and has other pressing issues to worry about, like rent. But shortly after, he is forced to go to the emergency room due to the pain. After a hefty bill, Jack gets an examination and is referred to some organizations out of a resource directory and is handed a pamphlet, then sent on his way. Half the time, patients like Jack have no idea how to access those resources, are too busy, or don't really trust the organizations that do reach out to him. Within a month's time, he ends up back in the emergency department. Healthcare costs that are avoidable and stem from social issues like this amount to $1.7 trillion annually for health insurers and millions of dollars to individual hospitals. To break this cycle and many others, we believe that community-based organizations are the perfect partner for healthcare entities due to the trust, reach, and experience they have, which is why 75% of community-based organizations provide healthcare-related guidance. That's where Healthhopx comes in. Healthhopx software creates and manages contracts between community-based orgs, healthcare providers, and health insurers. Now people like Jack can receive services and the guidance they need from familiar entry points that are coordinated with healthcare entities. Community-based organizations are able to track and distribute services to patients, all the while bringing in paid contracts provided through Healthhopx that allows money to flow back into the community. And healthcare entities are able to send directives to multiple community-based organizations with minimal time and effort to meet healthcare goals. Impact and ROI analysis is also done through our AI machine learning team to guarantee efficient partnerships. Our system also allows patients to accept and receive services from trusted members in the community, even without a smartphone or Wi-Fi, through text. This system helps reach out to patients like Jack to get him to utilize the right services at the right time. With our platform, Jack can be referred to an actual community organization member that guides him through his needs. And Jack can accept these services through text without needing a smartphone or Wi-Fi. Now Jack can receive the proper information and resources to keep himself healthy and out of the ER, saving thousands of dollars to hospitals and insurers. We have an experienced team and advisory board to service your needs, and we can join your urban, rural, large or small community through a hospital, clinic, insurer, or government organization as a paying partner. We would then get to work establishing the marketplace and partnerships with community-based organizations through our software to address community needs. Thank you for your time, and I hope you can join us in building healthier communities.
All right, Wesley Ma, ladies and gentlemen. Desperately needed tools to help to lubricate the system of at-risk patients accessing services through nonprofits and medical health entities, and Healthhopx can make that happen here in Kansas. So think about who he should meet. Okay, now we're gonna hear from Jessica Eggert and Legup.
Hi everyone, I'm Jessica Eggert, the CEO and co-founder of Legup, and we are a childcare enrollment success platform. And we believe we can help strengthen the childcare industry through collaboration and providing critical infrastructure to help the childcare industry grow. I started with Legup because I came from a background in operations and HR, working with national organizations, and I saw the struggle that parents went through every single day to find care and keep quality, affordable care. And when I became a parent myself, I knew I had to do something to make it not only easy for me to find care, but for other parents who were coming behind me. What most people know is that the demand for care greatly outpaces the amount of supply. But what most people don't know is what care is out there, who's looking for childcare, when do they need childcare, and how do we connect them with that available childcare? This problem not only affects the parents, but it also affects the employers who are looking to hire them and the childcare providers themselves. So our team of former childcare directors, technologists, parents, and childcare advocates came together to build Legup. Legup is the childcare enrollment success platform, making it easier for parents and providers to connect across the country. Our mission is to help parents and providers connect seamlessly so that way those childcare programs can stay full and we can help keep families in the workforce. And that's because providers want to focus on providing quality care and educating children, but they also want to grow their business. But that manual work and a lack of resources is keeping them from doing so. Employers want to recruit and retain a diverse, talented workforce, but childcare issues are causing absenteeism and turnover. And the partners out there who are doing a fantastic work with childcare providers already are lacking the real-time supply and demand data that they need to implement fantastic policies and programs to help support their community. Legup helps support that entire childcare ecosystem. Let me show you how. So providers are our first priority. We give them free enrollment and marketing management tools to help keep them out of the back office and really help them focus on the children and what they love to do. We get rid of all that manual work, helping them manage wait lists and tours. They get them out of their spreadsheets. We're replacing sticky notes and making it easier for them to not spend time on the phone and get out of their emails and again, get back into the front office, supporting their staff and the children and the families who are part of their business. For employers, we offer them a private marketplace and family concierge services that help their employees be able to find quality care in their area, join the right wait lists, schedule tours, and then just making it easier to go through the entire childcare process. We even help those employees offset some of those enrollment costs for their families. And for our partners, we give them real-time supply and demand data through our partner dashboards and our marketplaces. And that data and insights helps them implement policies and programs in their community that can help strengthen that childcare industry, supporting their parents and supporting the childcare programs themselves. We're a young Seattle-based company. We're growing our footprint every single month in new communities across the country. We work with resource and referral agencies, state agencies, employers, state chambers, and the childcare providers themselves. And when we go into a new community, we can work with any one of those stakeholders. We believe that by working together, we can implement our enrollment success platform and create a stronger ecosystem. We would love to collaborate with you. Feel free to reach out at jessica@legup.care. Thank you.
Jessica's also a talented ventriloquist, as you could see. Jessica Eggert, ladies and gentlemen, right down here in front, stand up. The reality is there are childcare deserts in this state. There are employers suffering and unable to hire workers because the childcare shortage has left them without the option of going back to work. There's providers that could offer care, but the business side or the administrative burden or the enrollment pathways are not clear to them and frankly not up their alley. Legup can help us conquer that problem throughout the state of Kansas. So let's think about who Jessica should get to know. Okay, we're moving on to IT Simple and Ron Freeman.
Hi, I'm Ron Freeman with IT Simple, and we help our customers to engage with their communities in a unified way and wherever people are. I'll start with my own personal story, my family story relocating to the United States about 8 years ago. When we just moved, we were looking for essential services, being a taxpayer in our community, and we thought with technology today, that's going to be an easy task. I used to run back in the days, so I was looking for a running track. I Googled, just like everyone else, I guess, and that was quite of a challenge. I had a lot of outdated results and unstructured information that was very challenging for me to find the information I was looking for. A few weeks later, we had a thunderstorm, which actually blocked, and with debris, blocked one of the main roads to our house. It took us about 15 minutes round tour just to get back to where we needed to be. All of a sudden, you realize that if you knew about that in an efficient way, you could probably save time and energy. Those are my daughters, actually enjoying themselves in Mother's Day cupcake decoration workshop in our community center. And when my wife came back with this picture, the one question I had is, where's everybody? So I inquired with some of my neighbors, and I realized that actually finding some of these events was quite challenging, not for us, rather to everyone else in our community. That's Touch a Truck. Our public safety department runs an annual event for the kids of the community to climb on the fire trucks and the police cars, which my daughter brought to me on the newspaper and said, hey, Dad, I want to go to that event. I'm sure, let's go. A couple of weeks later, my daughter asked me, hey, Dad, when are we going? And I'm sorry to say I forgot. Why? Because for me, it wasn't on a digital space on my mobile phone, just like any other meeting that I would never be late for. So I tried to inquire with the City Hall. I called and asked if there's a good way for us to know and let know about things. What's the best way to engage with them today? And the answer I got is just go on our social media. Well, I have privacy concerns, and for me, social media, it's not really an avenue that works for our household. And, and they said newsletter. These are too cluttered, and my inbox already over busy. Website is really just static and reactive. It's not a proactive way for me to get informed about things as they happen. And also some of the new technologies, just like chatbots, they live on these reactive websites. So it didn't really work for us. Communities need to engage with their local government in an efficient way that they can do. So I'm Ron Freeman, 20 years in IT, 15 years cybersecurity, and the problem we are solving is helping our governments to engage with their communities and in a quick way where residents and citizens can trust. 82% of Americans are using mobile devices online. That's a fact. There are 90,000 local governments in the United States, and 95% of them doesn't have mobile development or R&D resources whatsoever. City manager, administrator, clerk, fire, police chiefs, or sheriff, no matter the size of your town. Today, with IT Simple, we can help you to engage with your community in a unified way wherever people are. Web, social, mobile, from a one simplified dashboard and with no requirements for IT. We believe in customer service is the most important. That's what we do. We provide a turnkey, no-code solution from a one single dashboard. We just happen to make great apps. Start your obligation-free pilot today. We make IT simple.
Thank you, Ron. Ron Freeman from IT Simple, he wanted to show us pictures of his daughters, but somehow we didn't get those in the video. So you'll have to see those online. They're gorgeous little girls. Ron Freeman from Israel, by way of Alpharetta, Georgia, now in Kansas, helping to make communities stronger and more connected with their local government and public safety organizations. Thank you, Ron. Stand up. All right, now we're going to hear from Televeda.
Hi, I'm Shruti Guradanti, the CEO of Televeda. Harvard did one of the longest studies on happiness, and they asked people in their later years of life what really gave their life meaning and purpose. And 3 things came up. Across the board, white collar, blue collar, regardless of socioeconomic background. Connections. Connections to their family, their friends, and their local communities. So their local community center, their local bingo bunko, their local book club, and that's what Televeda does. We help people find connections and meaning and purpose. Televeda is an award-winning platform of choice for innovative community-based organizations like Banner Health, large cities, county health departments. We're in over 15 states today and have over 500,000 eligible members within our network. Social isolation or loneliness is a complex problem. Over 40% of older adults today report feeling isolated. Now, community-based organizations work very hard to create programs to keep this population engaged. And today they're doing that through virtual hybrid programs. But they really lack the time, the staff, and the expertise to create quality programs that cause people to come to them, create adherence, and have a sustainable program in the long run. It takes about 3 hours per participant for a staff member to create these programs. And so that's where Televeda comes in. We are a software solution that also has services comprised in it. We provide a community-based organization with the entire end-to-end experience, all the way from helping them digitize and standardize their programs to creating a network of social care programs, and ultimately understanding and tracking the outcomes based on the data that we collect. So how does it work? When an organization signs up with us, they get their fully branded, trusted virtual platform that their members can easily register and sign up with, and then ultimately find the program that best suits their interest or their behavior and connect with their peer group. This is how the platform looks. It's simple, but what it does is it brings together the thousands of programs that are being provided on the platform in one easy, seamless process so that the older adult can easily navigate and find what works best for them. But really, the party and the magic is on the back end. This is where we collect all of the data that you need in order to see what you need to do in order to create a meaningful program, in order to create adherence, and create that sustainable program. Virtual hybrid programs seem like a nice to have, but really it is a necessity today. Over 90% of folks we surveyed said they always want to have the choice of having virtual programs. And that's what we're helping community-based organizations do effectively and efficiently so that they can keep their members engaged wherever they are, outside the 4 walls of their community center. If you are a modern community looking to get into this modern tech-savvy world, we're the team that can help you effectively and efficiently do this and save anywhere from 15 to 25 hours per week while getting this done for your members. Would love to chat with you. Thank you so much for your time.
So Shruti and her co-founder Mayank are both back there. Stand up, raise your hands. Folks, we know we need to engage with seniors in modern ways. We know that social isolation as folks try to age in place is an issue, but folks running senior programs around our state do not want to be and cannot be the tech experts that Televeda can make them look like if they work together to have these sticky, engaging, proven programs out in their communities. Okay, guys, so we're kind of in the home stretch. We've got a few left, but we're going to take a tiny break. Because if there's anyone sitting in the room that has thought so far, all right, I'm not helping. I don't know anybody to connect these people to. We've got a thing that the only qualification for how you can get engaged and be helpful is to know someone over the age of 65. Who falls into that category? Who is acquainted at some level with somebody over 65? Come on, people. All right, let's roll this video and see if we can all get together on a cool effort that's coming up in the next couple months.
As we all know, the pandemic has been devastating, especially toward older adults. The loss of life, the shutdown, social isolation continues.
Stop! You're boring us. You know what we need around here? I got 5 letters for you. B-I-N-G-O.
Is that a new grant program?
Hi, all. You know me as Zachary Kelly, a 2-time Olympic gold medalist. And I know just what this country needs. They say older adults can't have fun aging. They say that you guys don't know how to use technology and that you've fallen and can't get back up. We're gonna prove to them and we're gonna get back up and we're gonna set a new world record for bingo.
I love bingo.
Bingo! I like my bingo numbers like I like my tumors. Benign. Yeah? Yeah?
G47? Did he say G47?
B-I-N-G-O, folks. World record, it's gonna happen with our help. Okay, at least you're laughing. All right, we're moving on. We're gonna hear from Mackenzie Drazan and My Resource.
Hi, my name is Mackenzie Drazan, and I am the CEO and co-founder of My Resource, a platform that helps institutions connect their communities to mental health care. Let me tell you why I'm here. In 2014, I lost my sister Shelby to suicide after an intensive 2-year struggle with depression, anxiety, and an eating disorder. This is what Shelby's care journey looked like. We were ping-ponged around the mental health care system, despite having Stanford Psychiatry and primary care providers quarterbacking her case. After several years of intensive market research, it became clear to me that this triage problem that our system faced is rooted in a data maintenance problem. And I believe that is why Shelby's providers struggle to find her the right care, because it's so hard to keep a provider network up to date at scale. And I believe this is why no one has solved this problem yet. To make matters even more complicated, patients are often directed towards their health insurance company's website. But the problem is that these provider directories are made for both physical and mental health care. And the filters that they have for physical healthcare directories don't have the right criteria that you can search by to find the right mental health care, leading you back to square one. This is exactly what we solve for. We collect and maintain over 100 data points on mental health providers and provide the user with a search experience that can help guide you through the process of finding the right care. To date, we have helped connect over 50,000 students to the right mental health care, and were awarded a $1.2 million grant from the National Institute of Mental Health to build and clinically validate a machine learning triage model to connect people to the right care. My resource can help your community organization connect people to mental health resources across Kansas. My resource guides people through the process of looking for care, whether it's their first time thinking about seeing someone or their 100th therapy session. For patients who are located in rural areas where mental health providers are not around for miles, we can help you find a remote provider that you can see in the comfort of your own home. Overnight, we can give your organization the ability to guide and connect your community to effective mental health care. So whether you are a community center, a university, a hospital, or a health plan, my resource can empower your organization to connect your patients to the right mental health care. Contact us at info@myresource.com to join leading health institutions across the country using my resource to connect their patients to the right mental health care. Thank you.
Mackenzie, stand on up. I lost you. Where'd you go? There she is, Mackenzie Drazen. Guys, connectivity, we have got to build connectivity. We have got to help robust up the resources for mental health care in both rural and urban areas of our state. Those folks that think we can help Mackenzie get connected to folks in Kansas to help make that happen, let's be imaginative. All right, we're gonna hear next from Mark Salisbury and Tuition Fit.
We've all seen the headlines. Skyrocketing college costs. Millions of people pinned under $1.8 trillion in student debt. But other headlines tell a different story. The college affordability crisis, it's a myth. And total dollars awarded in financial aid and scholarships is at an all-time high. Believe it or not, both stories are true. Today, a typical student, let's call him Johnny, could be charged anywhere between $5,000 and $85,000 for his first year of college. Unfortunately, although it takes Johnny well over a year to look at colleges, apply to a select few, and find out his fate, Johnny won't find out his actual prices until just before he's supposed to make a final choice. This utter lack of price transparency forces many families into terrible borrowing decisions. Maybe Johnny just ghosts the process altogether. I'm Mark Salisbury, and I'm the CEO of Tuition Fit. More than ever, we need timely and accurate information so that everyone can find college at the right price. My co-founder and I bring 40 years of experience navigating the college landscape, and we've built a solution that empowers the public with the information they need when they need it. Tuition Fit is a Kelley Blue Book of actual college prices. Our data comes directly from students and families themselves. Because all those actual prices aren't locked in a vault somewhere. They're lying around on kitchen tables all over the country in the financial aid award offers that college applicants receive every spring. By crowdsourcing this data, while ensuring privacy and anonymity, we create a central database that continually validates itself as more people share data. In 2 years, we've gathered over 15,000 offers from 1,000 colleges and universities all over the country. We've already begun to generate some revenue from users who want more detailed pricing information and from college search professionals who want to provide better guidance. In addition, the national media has highlighted us as a real solution. We've appeared on many different podcasts, and over 50 different college search companies are actively promoting Tuition Fit because their customers' #1 concern is finding college at the right price. Creating real price transparency has allowed us to think big, and we believe that Tuition Fit is the key to unlock a whole new way to shop for college. A central marketplace that empowers the global public to find college at the right price, no matter what kind of education they need, when they need it. So parents, students, high school counselors, anyone helping families through the college search process, join us at Tuition Fit and make transparent college pricing a reality, so we can make it possible for everyone to find college at the right price.
Mark Salisbury with Tuition Fit. Ladies and gentlemen, I'll tell you, this innovation has the most power to make the difference in the lives of first-generation college students, families that are new to this game. Let's work with Mark to find connections throughout Kansas so that Kansas families can benefit. All right, we're moving on. Kaizen Health. Let's hear.
Hi, my name is Mindy Kniebel, and I'm the founder and CEO of Kaizen Health. Kaizen Health is a healthcare logistics company that I started because my own family struggled to access healthcare. In fact, it's not just my family. In fact, every year, 3.6 million Americans delay their healthcare due to a lack of transportation. There are two major components to Kaizen Health: our transportation network and the technology that powers it. Our transportation network is comprised of everything from rideshare, taxis, medical transportation sedans, wheelchair-accessible vehicles, vehicles with car seats for children, stretchers, and non-emergency ambulances. We also work with volunteer networks, public transit, and even courier and delivery services, because sometimes it makes sense for us to go out and go to the grocery store or go to the pharmacy, and other times it makes sense to bring those supplies in the home. Our technology platform is a bunch of rules engine and an ordering platform all put together. So the initial rules engine is really controlling the rules of the client. So we work with health systems and clinics, FQHCs. We work with Medicaid, Medicare Advantage, clinical trials, senior living, home health, nonprofits and municipalities, and they all have their own rules. So they might say, I don't want to give a ride over 100 miles or $100, or everyone gets a wallet of $500, whether it's paid transportation or mileage reimbursement. Or maybe it's 30 pre-approved trips per year, but they're only to these pre-approved locations. And so long as the trip meets that criteria, it's matched with one of our transportation partners based on their own rules. That's the geography that they serve, their hours of operation, and the exact vehicle types that they offer. The Kaizen Health platform is many different rules engines plus an ordering platform all pulled together. So we work with many different client segments. We work with health systems and clinics and FQHCs, Medicaid, Medicare Advantage, clinical trials, senior living, home health, nonprofits and municipalities. And they have their own rules that they must abide by. So some might say, I don't want to give a ride over 100 miles or $100. Others may limit to a $500 wallet per person, whether that's paid transportation or mileage reimbursement. Others may say you can have 30 trips per year, but only to these 30 pre-approved locations. And so long as these trips meet that criteria, they're matched with one of our transportation partners based on their own rules. So that's the geographies that they serve, their hours of operation, and the exact vehicle types that they offer. Now, technology is amazing and wonderful, however, it doesn't solve everything. And you can still pick up the phone and call and order a trip to Kaizen Health. Folks can receive text messages and phone calls to their home phone, to a caregiver's phone, to update them on trip status. We also offer a variety of different languages because it's important to meet someone where they're at, in their language and their mode of technology that they're comfortable with. Now, as Kaizen evolves, we've mastered the most important social benefit out there, and that's transportation, and it's the most difficult. But logistics is a thread throughout all of the rest of the social determinants, such as social isolation, food insecurity, education, employment, and housing. And we plan to keep on evolving to solve logistics across all of these. And this is the team that's going to lead it. I have the most wonderful team and wonderful colleagues that I have the pleasure of working with. We have about 50 folks on the team leading the charge, largely from the Chicagoland area. And our motto at Kaizen Health is that every trip counts. Thank you.
So Mindy jetted into Wichita on Monday, filmed that, and then headed to Las Vegas to be a speaker at a health tech conference to spread that gospel of connectivity to healthcare as a real breakthrough in combating the social determinants of health that we've talked a lot about today. So in her place today and representing Kaizen Health, where's Eric Reynolds? Drove in from St. Louis, battled the orange cones to get here to Wichita, and he'd love to speak with you about connecting. We've got some super connectors in the room. I'm looking at Marcy Penner down here. We got Rob and Tanya and Connie and the crew from Wichita State back there. So I want to see pens moving and thumbs moving as we connect these wonderful founders to folks that can help them thrive in Kansas and solve our community's pressing issues. We've got one last finalist. I saved him for last because he's a hometown guy, the one Wichita-based, the one Kansas-based founder that made our finalist list. Ladies and gentlemen, let's hear from Miguel Johns.
Hi, my name is Miguel Johns. I'm a co-founder and the CEO of the newly rebranded Moment, formerly known as KingFit. We create results-driven moments between healthcare organizations and their patient populations using social media. After years of working with diabetes prevention and diabetes management programs, we learned that the traditional ways of recruiting and enrolling participants were no longer working. Thanks to digital marketing research, we now know that in the age of the internet, you can't just ask people to buy now, which is what we do when we call them, email them, or send them a letter asking them to enroll in our programs. We believed that if we could transform the way we engage people, we could then nurture them, build trust, and call them to action when the moment was right. And as a result, we'd increase the number of people willing to participate in our offerings. We decided to test our theory using our own social media pages, Diabetes Care and Diabetes Care Espanol, and we've had amazing success. In the first 18 months, we reached over 1 million minutes of diabetes education content viewed. We grew our community to over 40,000 people with diabetes, and those 40,000 community members have engaged our content over 3 million times. We know that we're not doing anything special, and so we wanted to make it very easy for you to replicate our process. And so today, I am proud to introduce you to our new social media toolkit that you can use to start driving the same results in an hour or less. With our 100% customizable toolkit, you'll get the content to guide your patient populations through the problem-aware, information-gathering stage, and then call them to action when it's time to enroll. We provide you with the posts, we provide you with the copy, and we provide you with the how-to guides to take you through the step-by-step process to reach success. Today, you can get started with the toolkit for only $99, and in honor of the competition, we will be discounting our launch workshop price until the end of the month, if you need a little bit more assistance getting started. If you are ready to begin leveraging social media to increase the participation in your programs, please do not hesitate to contact me. It'll only take a moment. Thank you.
Stand up, Miguel. We're kind of excited to be a part of his big rebranding news. Congratulations, Miguel, and best of luck. And he's offering quite a deal, folks, so let's get him some partners. All right, speaking of partners, Thrive Allen County, Katie, come on up. My rural partners, come up first. Come on up this way towards the stage. This is where we get to tell you about the stickiness, the traction, and the progress that Kansas communities have made over the last few weeks in engaging with these founders and the ambitions they have for innovation projects going forward. I'll lean on the folks from Thrive Allen County first, and they'll tell you a little bit about their process here within the NXTSTAGE Community Health and Vibrancy competition presented by Blue Cross Blue Shield of Kansas and what they're thinking in terms of the future. Come on up, guys.
Good afternoon, everyone. My name is Lissa Regier, and I am the president and CEO of Thrive Allen County. We are a health, wellness, and economic development organization located in Southeast Kansas. And today, I am honored to have some of my awesome team with me. We have Jessica Thompson, who is our Deputy Director and Grant Writer Extraordinaire, and Jonathan Gearing, who is our Economic Development Director, and also who has led us through this next stage opportunity and has done an amazing job for us with that. We have been so honored to have been here in Wichita over the past couple of days with these awesome founders. We got here Tuesday evening, went through a really awesome happy hour at the Greater Wichita Partnership. We got to really get to know them in a very informal setting. And we also got to be introduced to the folks at the Greater Wichita Partnership, which was also wonderful for us, and we look forward to further conversations there. But these founders have such a passion for what they do, and it really starts to rub off on you. And so that first night I told these guys, oh my gosh, I'm so excited, this is gonna be amazing. And so the next day, which was yesterday, we got to spend hours meeting one-on-one with these founders, learning why they are so passionate about what they do and how we can find synergy between the issues, the problems, the opportunities, and the challenges that we have as we represent rural Kansas, most specifically Allen County, but we also have an arm of Thrive Allen County called Thrive Kansas, where we work with rural communities across the state. And so one of the things I am so excited about is that although we are thinking of Allen County as a pilot pilot community, we are also thinking about all of these rural communities that will be able to further benefit from these founders. And before I go on and tell you who we are so looking forward to collaborating with, I want to say one more thing. It has been so important for Thrive to be in person with these founders, and COVID has changed a lot of things, and I'm so grateful that we have technology we didn't have during pandemics hundreds of years ago. Being online is great. Being in person is so much better. You get to actually feel that energy come off of each other. You get to truly connect. And one of the things we got to do yesterday over lunch was talk with Wes and Stephanie in Houston over what it means to be entrepreneurs. Because one of the things we want to work on in Allen County is how do we become a rural community that is where entrepreneurs want to be? How do we encourage them to be here? And we learned so many things, including, I'm just going to be really honest and say, I didn't know what the heck a unicorn was. I thought it was a flying, beautiful beast. And apparently it's a $1 billion organizational thing. And so we're learning all kinds of things. And we think through these awesome conversations with our entrepreneurs who are here that we can create in rural communities a space where they want to be. And so with that, I want to say there are multiple founders in this room that we really look forward to finding ways to work with in the near future. That includes IT Simple, Kaizen, Healthhopx, and Dental. We see great synergy between what you guys do and our needs and opportunities in rural Kansas. So I really look forward to us finding ways to bring you on board for this work. We are an 85% grant-funded organization, and we currently have a couple of grants that are very specific to areas that a couple of our founders are working in, and that is Legup with childcare and Televeda with social isolation. And so we already know within grants that we currently have that we're going to be able to work with these founders. So we are super excited about that. And then our final founder that we are really excited about is Advocacia, and that's who we will be utilizing through the next stage process to work with our care coordination, which we have had for years at Thrive Allen County, but on Google Docs. And so we're really excited to figure out how as a community we'll be able to utilize Advocacia in Allen County and then hopefully be able to talk with rural communities across the state and how they might be able to do the same. But I just want to say thank you so much, Mary Beth. This process has been amazing. We highly encourage anyone who gets to be involved in this in the future to be in person with these founders because you will not regret it. Their energy and passion for what they do is amazing, and it will energize you and will make you want to find all the ways you can bring them on board to assist in all the work that you are doing. So thank you all so very much. We're so grateful to be a part of this process.
We like to start with a bang. So we've got four founders and companies that got a shout out for future collaboration. We've got Legup and Televeda, where existing grant projects are going to allow them to do a pilot in Allen County. And then Advocacia that will kickstart so I haven't shared this with y'all, but part of Blue Cross Blue Shield's support for the program is that we set aside some of their support money, and that's going to go directly into communities as kind of the seed funds for pilots that they choose coming out of the competition. We wanted them to be able to make some decisions without the first dollar being a problem. And so Advocacia, Legup, and Televeda, congratulations, you guys. And thank you so much, Allen County. It's been a pleasure. All right, we're going to grab Katie Eisenhower, and representing Scott County. Come on up next, Katie.
Good afternoon. It is such a pleasure to be here today. I am the economic developer for Scott City, Scott County, Kansas. We have one incorporated community. It's fairly simple. I do love my town, though, by golly. And I think Wichita loves my town, too, courtesy of a guy named Ron Baker. But anyway, it has... Yay, buddy. And I think you got him back, if I'm not mistaken. Aren't you excited about that? Anyway, enough of that. This has been an extreme pleasure for me. When I get an email from Eric Peterson that says, yeah, Mary Beth, I'd like to introduce you to 5 economic developers that are part of our e-community process, and I think that they would like to participate in this program. Network Kansas is an enormous partner in economic development in Western Kansas in particular. I cannot do my work without that organization. So, of course, I did not say no. And I'm so glad that I didn't. I'm a one-girl office. It's a little tough to get the work done to grow a community of 4,000 into something that we envision might be 5 again someday, like it was in 1980. But here we are. And I'm so grateful that I took the time to watch about 11 presentations to help narrow the field. I felt so overwhelmed and unqualified to do this process. But it was contagious. When you see these entrepreneurs and these founders who have invested so much of themselves into these innovations, how can you not think that that's sexy? Seriously. So it just took off. And so I watched those presentations, but I didn't get here until last night. Unlike Allen County, you guys were really overachievers. But it's been an extraordinary time because Ms. Regier is right. You have to meet these young people in person to understand how it could work in your community. And I'm dead serious. I am back there writing notes about every single organization in town. Because I might be the only person who's working on this process in Scott City, Kansas. But it's my job to take it back because it can't possibly help Scott County if I'm not reviewing some things so that I can share with others. So we've had meetings with our CEO and a team of 8 at our hospital with regard to dental and what it might be able to do for accounts receivable that's, outside credit policy. I've also had some unique conversations and special conversations with Ron Freeman. I don't know exactly where we're going to land, but I'm trying to have communications with every single one, take videos back so that I can share it with my team. We're meeting with the city administrator and the mayor at 2:30 today with regard to Shruti in the back with Televeda. So we're not done yet in Scott County, and we haven't really selected a bona fide pilot, but I'm very confident that we're going to have more than one that lands in my town. So I don't have that awesome announcement that you did, yay you, Allen County, and I'm so grateful that you're holding up the banner for us in Kansas. But thank you for coming from all over the globe, especially Canada. And by the way, Scott City, Kansas, you can land there if you like. But I am grateful to Mary Beth. She's a rock star. I'm grateful to all of you who sponsored. This makes a difference. So please continue to do so. And to my friends Steve Radley and Eric, I'm honored. Thanks for letting us be a part. Thank you.
Speaking of rock stars. All right, Katie, thank you. So Dettel, IT Simple, Televeda, and who knows who else have got opportunities percolating for them in Scott City, Kansas. All right, Carrie Folletti from Cali County. Raise your hand, Carrie. I forget where I put you. So Carrie has had a dialogue with a number of our companies, and kind of like Katie, they're not quite ready to name a pilot partner yet, but great shout outs. Carrie and Ashlyn are here from Cali County to get to engage in person with IT Simple, Healthhopx, CoTeacher, and then they've also connected with Kilter, our one finalist who wasn't able to make it into town this week. So we're excited about the folks in Cali County, their ambition for innovation, their thirst for finding new ways to attack old problems in their community and to break through and create healthier and better connected communities and citizens in Cali County. So thank you so much for participating as a pilot partner, and we're honored you're here today. Thank you, Carrie and Cali County. All right, Leanne, come on up here. All the way from Hodgman County, Kansas, ladies and gentlemen, Leanne Seiler.
Well, unlike Katie, we came up with like 5 we wanted to work with. And so it's really been a struggle to narrow down who we're going to announce today and who we're still going to continue to work with, I'm sure of it. It just may not be through this pilot. But a step back, this has been a wonderful experience. I had a hard time, and I told Mary Beth this, the entire county of Hodgman County went to Colorado for the past couple weeks. There's been no one to work with. And as they come back, I grab them one by one and we re-watch videos and things. And so last week we kind of had our final meeting with as many people as we could get together. And we chose to move forward with this project with Televeda because before, I think I said that wrong, Televeda. Before the pandemic, we really struggled there with our senior population feeling like that we aren't able to connect with them well enough, and that there's sometimes some issues with them aging in place in our community, and we're really trying to tackle that. Then the pandemic came along and we realized they weren't the only ones that were struggling with that. And so we're hoping that some of our younger people will also use this platform and in some social isolation issues we're having even post-pandemic. We're also very interested in partnering with Tuition Fit, My Resources, CoTeacher, Dettel, and just watching the videos. I don't really see anybody we couldn't partner with if you know, that the innovation is there and the ideas to help people are there, and we're really excited about this. And if you get that call, if you're someone in your community get that call to be a pilot community in the future, I would jump on it. Don't waste any time at all sending back an email saying you really want to be part of this. Thank you.
All right, congratulations, Televeda, and good luck for the rest of you as Leanne continues to engage. Now we're going to hear from Kelly Larson Gorley. Pick your name. She is the gal in Lincoln County. Come on up.
I'm recently married, and I'm probably having the hardest time of anybody figuring out or remembering kind of a whole new name change sort of thing. So I guess first of all, I just want to say thank you very much to Nexus for this competition. It has been very eye-opening. I mean, I can kind of repeat what's already been said, but I never heard of Mary Beth before. I never talked to her before. Somehow, you know, through the powers of just kind of networking, you know, I feel like I was put on the email, and she called, and she kind of started talking about this, and it's kind of like well, I don't really know if I understand what's going on here. I don't really know, you know, how this is going to go, but I felt the energy. I felt the passion, and I felt the vision, and I think that's probably the one thing that always kind of gets me. Whenever there is a big vision for Kansas, like how can we be the pilot capital of the country, that's the kind of thing that I'm like, all right, I'm on board. I don't, whatever it takes, I'll participate. So with that kind of spirit that she had, I tried to embody that as well, looking at all the businesses and what they've got, and I was impressed. So I'm from Lincoln County, Kansas. It's a very rural community, about 2 hours northwest of here. Population of the entire county is 3,200. Our largest community is a population of 1,200. So we are very rural. We are very limited in terms of financial resources, people resources, but we've got a lot of great ideas and vision and a lot of need. And so with that, as I look through the different businesses, I guess I kind of want to give a shout out to the couple that I really honed in on. One was Legup. Childcare, if you're an economic development director and you don't have childcare a folder this thick on your desk trying to figure out how to solve the problem locally, then I don't know what you've got something going on that we don't have going on, because that's been a #1 topic here for me recently. And so hearing what Legup can do, I just thought that was incredible technology. How can we bring that technology to industry, a system that is just very, very complicated? And I'll say that for Lincoln County, our child care system, I feel like, is so broken right now and so limited that where I feel like we can really target there is more on a regional perspective. I feel like how we can best benefit isn't just from Lincoln County, but there is such a broader need, and there's some major conversations going on a regional level about childcare that I feel like that's the better fit. And so my hope is that I can kind of try and connect Legup there. Kaizen, who we haven't really had a great conversation with just because of timing and stuff going on, but I very much feel the exact same way about what they're doing with transportation. On a local Lincoln County level, I feel like, we're so small in terms of what we got the ability to do, but the regional transportation system and how our local people have to connect to some of the larger regional providers, there's something there, and again, I kind of want to see if I can facilitate a broader conversation there with a regional level. IT Simple had a great conversation because I think, in terms of communications, getting the word out, getting people to understand where information is, and putting the information where they are is also something that I think we need to kind of totally rethink from a local government perspective, from an economic development perspective, Chamber of Commerce, all that kind of stuff, is how we communicate with our local people. Televeda, I also feel like that's an amazing resource. In our conversation with them, I honestly, when we started the conversation, I was thinking about bingo. I kind of thought, hey, this will be really neat to how do we connect to bingo, and how do we connect to, just kind of these very small things. And through the course of our conversation, and I brought in a couple other people to that conversation with me, it kind of blew up. My mind kind of just kept going, oh my gosh, oh my gosh, oh my gosh. Because, when knowing with the whole pandemic and knowing how everything is going more online and again, connecting people with where they are, all of a sudden, we could put our city council meetings in one place. We could put our county commissioner meetings in one place. We could put the historical society meetings in one place so that we could, all of a sudden, it's not just engaging seniors, it's about, truly providing a way for everybody to engage with on all levels of what's happening in the community. And so that really just was kind of a mind-blowing conversation, and it's something that I'm really excited about, and I think that there's definitely a lot of possibility there. And then the last one, Kilter, there's connecting health and activities with fundraising. As a small communities, we are constantly fundraising for everything. And so that was one thing that I felt was very, very intriguing, is how do we maybe combine the two into a fun way to do that. As an example, our high school track needs a lot of work. And that's the kind of thing that costs a lot of money to fix. And so there's a fundraising committee to try and how do we rebuild our track. And when having this conversation with Kilter, it's kind of like, well, perhaps there's something there to help make this happen. Kind of like a couple other communities, and great ideas don't necessarily happen at a predefined schedule. So August 12th, the predefined schedule of making an announcement hasn't necessarily worked out for this. But great ideas do happen over time and they do evolve. So that's where I'm committed, is how do I continue to help move some of these conversations forward. I don't ever want to be kind of the gatekeeper of good ideas. I kind of want to make sure that I connect however I can to whatever's going on in our community and the region to help economic development and health. So with that, I guess thank you very much. This has been an awesome experience, and it's not over yet. So thank you.
It's definitely not over yet, and regional collaboration on some of these partnerships is going to make a world of difference, so thanks for setting the tone there. All right, Amy, I'm going to drag you up. Hunter Health, our partner from here in our own backyard in Wichita. They've got a whole team here today. Amy and Tara and their whole staff have been hugely supportive of this process from the beginning, and we'll let you guys come on up and tell us what you're thinking.
Thank you so much. Tara Nolan is our Community Health Manager, and I'm the CEO of Hunter Health. We're a community health center here in Wichita, serving about 15,000 unique individuals annually. And our mission is to improve the health and well-being of everyone in our community. And as many have said, we do know that health is more than healthcare, so we're continually looking for creative solutions. So, where's Tara? I'm here. So, I guess first of all, I really appreciate that, you often don't think of government organizations and not-for-profits when you're trying to think of innovation, technology, pilots. So thank you, Mary Beth, for thinking of us and including us in this process, because we are continually looking for creative ways to solve the challenges that our patients are facing every day. So we went through the whole process, and I think I'll be transparent. I told Tara, I just need you to do this with me. I know everyone's busy, but we're just gonna do what we can on this and try to give some feedback and then move on. And I think we were both pleasantly surprised throughout the process. Would you agree?
Oh yeah, absolutely. It was a great process.
Yeah. And I know we've met with Miguel many times over the years and have wanted to work with him for years, so it was kind of an opportunity for us to formalize that process and really move forward in that regard. But we actually found a few solutions where we think we have additional opportunity to explore with those vendors. Do you want to talk about Kaizen, the transportation?
Yeah, that was one. We had a lot of questions when we spoke with Kaizen. Just kind of like the logistics, and are we taking on this for the entire community, or how would this work? And we all know it's really hard for our patients with access to care to sometimes get that transportation, and we provide some transportation, but we really felt like this was something that was innovative enough and it would easy enough to use, that we could help build that network, and in something that I think here locally, we can expand out to other community partners. We mentioned, United Way would be a great partner to have in that, but we could build that network here and really, really serve our patients well.
Mm-hmm. The other one that we want to continue discussions with is dental, and I really appreciated how that solution could really be tailored to fit our mission. We do not send collections, our receivables out to collection. That's really not in line with our mission. And, but at the same time, we always need to maximize our revenue so that we can provide our services. And so really being able to find a solution where we can work with our patients, negotiate with them, and maybe find a way to close that debt for them as well as to receive payment. I thought it was a really creative solution. There's a way for us to do it in multiple languages, and about 16% of our patients are served in a language other than English. So that was a very creative solution for us. And then I think Healthhopx was the fourth one we looked at. And we're definitely looking at solutions to manage social determinants of health for our clients. So that will be something in the coming year where I think we're going to dig in a little deeper and see what the best solution is. And then honestly, through this additional round of just sitting here and watching all of the pitches, I saw a few more where I took notes and was like, you know, we probably do need to look into that a little bit more and see if there's a fit for us or for one of our partners. So, anything else to add? Or? Okay. For the gentleman from Montreal, I went to McGill University, so I can speak to you about all the great things about Kansas compared to Montreal. So, you can find me later.
Improving healthcare and providing ambassadorship directly to our foreign friends. I like it. Hunter Health, a defined pilot with Miguel and Moment, and then continuing discussions with Kaizen and Dettel and Healthhopx, and who knows else might get a call from them in the next few weeks. Ladies and gentlemen, I'm so delighted you came today. I am grateful for your engagement throughout this process. I'm grateful for your patience. You're probably hungry for dinner already, even after that delicious lunch. I'm hugely grateful to Blue Cross Blue Shield of Kansas for making this competition possible, and I'm really hoping you'll engage with us in future competitions. Next one that we have will finalize in October. We'll be bringing innovation to a different field, financial services and banking, except it's just as cool, and so we'll want you to be a part of that as well. So have a wonderful day. Please continue to do your work of connecting. Find those founders as you leave here today, or get in touch with me and I'll make the connection electronically. We appreciate your engagement, we appreciate your presence, and we appreciate your commitment to the health and wellness of Kansas. Thank you, and have a good day.